Let me tell you something that most doctors don't bring up during a routine checkup. And I say this not to alarm you, but because I genuinely believe what I'm about to share could change the quality of your life in ways you haven't expected. If you're over 70 or even approaching that age and you've been dealing with tingling in your hands, numbness in your feet, a burning sensation that seems to come out of nowhere, or that maddening feeling like your legs just don't respond the way they used to, I want you to stay right here because this video was made for you, not for a general audience, not for someone half your age, for you specifically right now in this season of your life. I've spent years looking into how the aging body changes, how certain nutritional gaps sneak up on us quietly, and how something as simple, and I mean genuinely simple, as a single vitamin has shown real, measurable, science backed results in reversing nerve damage, sometimes in as little as 14 days. I know that sounds bold. I know it probably sounds like one of those claims you've heard before that turned out to be nothing. But I want you to give me a few minutes because I'm going to walk you through exactly what the research says, what's actually happening inside your nervous system as you age, and what you can do starting today. Not next month, not after another specialist visit, today. Before I get into it, I want to ask you something directly, and I genuinely want you to answer in the comments below. Have you ever told your doctor about the tingling or the numbness and been told it's just part of getting older? Just leave a yes or a no down below. Because the number of people who have been told to simply accept nerve discomfort as an inevitable consequence of aging, that number is staggering. And I want to know if that's been your experience too. Now, let's talk about what's really going on. Your nervous system is one of the most extraordinary systems in your entire body. It is the communication highway between your brain and every single part of you: your fingers, your toes, your organs, your muscles. Every sensation you feel, every movement you make, every signal your heart gets to keep beating at the right rhythm. All of it travels through a vast network of nerves. And at the center of keeping those nerves healthy, at the very biological core of nerve function and nerve repair, sits a family of nutrients that most people over 70 are dangerously low in without even knowing it. I want to talk to you today about vitamin B12, and more specifically, the form of B12 called methylcobalamin, because this is the version that has shown the most remarkable results when it comes to actual nerve regeneration. Not just slowing damage, not just managing symptoms, actual measurable regeneration of damaged nerve tissue. And when I say 14 days, I'm not making that up. There are peer reviewed studies, including research published in journals focused on neurology and peripheral nerve disorders, that have documented significant improvements in nerve conduction and symptom relief in patients with nerve damage in that exact time frame when given the right form and dose of this vitamin. But here's what I need you to understand first, because this is the part that will make everything else make sense. As we age, and this process accelerates significantly after the age of 60, our bodies become increasingly less capable of absorbing B12 from food. And I want to explain why, because it matters. When you eat a piece of steak or a piece of fish, the B12 in that food is bound to protein. In order for your body to absorb it, your stomach needs to produce something called intrinsic factor, which is a protein made by the cells lining your stomach. Intrinsic factor grabs onto B12 and escorts it safely to your small intestine, where it can be absorbed into your bloodstream. The problem is that after the age of 50, and increasingly after 70, your stomach produces dramatically less intrinsic factor. The cells lining your stomach, called parietal cells, start to decline in number and function. This means that even if you're eating a perfectly balanced diet full of meat, fish, eggs, and dairy, your body may only be absorbing a fraction of the B12 you're taking in. This condition has a name. It's called atrophic gastritis, and studies suggest that somewhere between 20 and 30% of adults over 60 have some degree of it. That means roughly 1 in 4 or 5 people your age is walking around with compromised B12 absorption right now. And most of them don't know it because the symptoms come on so slowly that they get mistaken for normal aging. What does a B12 deficiency actually feel like? It feels like tingling in the hands and feet. It feels like numbness that comes and goes or sometimes just stays. It feels like a strange burning or electric sensation along the legs. It feels like fatigue that no amount of sleep seems to fix. It feels like difficulty with balance, like the ground isn't quite where you expected it to be. It feels like brain fog, difficulty concentrating, or a memory that seems to be slipping more than it should. In more advanced cases, it can feel like muscle weakness, difficulty walking steadily, and even mood changes, depression, irritability, anxiety that seems to have no clear cause. Now, here's the part that genuinely troubles me because I care about this audience and about older adults getting the care they deserve. Most of these symptoms, when reported by someone over 70, get attributed to age. The tingling gets called peripheral neuropathy with no treatable cause. The balance issues get attributed to general aging of the vestibular system. The fatigue gets blamed on poor sleep or just the natural slowing down of the body. The brain fog gets quietly filed under early cognitive decline. And the patient goes home with no solution, no treatment, and no reason for hope. But here's what the research actually shows. When the root cause of these symptoms is a B12 deficiency, which it very often is, and when that deficiency is addressed with the right form of B12 at the right dose through the right delivery method, the nerve damage can and does begin to reverse. And the timeline can be shockingly fast. I want to walk you through what methylcobalamin actually does in your body because I think once you understand the mechanism, the actual biology of what's happening, you'll feel the urgency and the hope that I feel when I look at this research. Every single nerve fiber in your body is wrapped in something called a myelin sheath. Think of it like the plastic coating around an electrical wire. That coating exists to protect the nerve and to help electrical signals travel quickly and accurately from one place to another. When your B12 levels are low, the production and maintenance of that myelin sheath is compromised. The coating begins to thin. It begins to break down. And when it breaks down, the nerve signals that are supposed to travel cleanly and quickly start to misfire. They become slow, distorted, painful, or absent altogether. That's the tingling. That's the numbness. That's the burning. That's the weakness. Methylcobalamin, the active neurologically available form of B12, plays a direct role in the synthesis of myelin. It is used by your body to produce the raw materials that rebuild that protective sheath. It also supports something called axonal regeneration, which is the regrowth of the actual nerve fiber itself. And in a healthy body with sufficient methylcobalamin, that regeneration process is ongoing. It happens naturally. But when you're deficient, it stops. The damage accumulates faster than the repair. And over months and years, what started as occasional tingling becomes persistent numbness. What started as mild imbalance becomes a real fall risk. There was a particularly compelling study conducted in Japan, and Japan has actually been ahead of the curve in using methylcobalamin for nerve repair, where patients with diabetic peripheral neuropathy were given high dose methylcobalamin injections. Within 2 weeks, the majority of participants reported measurable reductions in pain, tingling, and numbness. The researchers also documented improvements in nerve conduction velocity, which is the speed at which electrical signals travel along the nerve. And this is an objective, measurable marker that doesn't depend on how a patient reports feeling. The nerves were objectively functioning better in 2 weeks. Now, I want to be careful here because I want to be honest with you. Not every case of nerve damage is caused by B12 deficiency, and not every person will experience the same speed of recovery. If your nerve damage has been building for years, if it's severe, or if there are other contributing factors like uncontrolled diabetes, heavy alcohol use, or certain medications, particularly metformin, which is one of the most commonly prescribed diabetes medications and is known to directly deplete B12, then the timeline for recovery may be longer. But the process of recovery, the biological potential for nerve repair, that doesn't disappear just because you're 70 or 80. Your nerves retain the capacity to heal. What they need is the raw material to do it. I want to talk for a moment specifically about metformin, because if you are taking this medication, this is something you absolutely need to know. Metformin is prescribed to millions of people for type 2 diabetes, and it is effective at managing blood sugar. But one of its well documented side effects is that it blocks the absorption of vitamin B12 in the gut. Studies have shown that long term metformin use can reduce B12 levels by up to 30%. And yet, in most clinical settings, patients taking metformin are not routinely monitored for B12 deficiency. They are not told to supplement, they develop neuropathy, they are then prescribed medication for neuropathy. And the root cause, the B12 deficiency caused by the medication they're already taking, goes unaddressed. If you are on metformin, please bring this up with your doctor. Ask to have your B12 levels tested. Ask whether methylcobalamin supplementation is appropriate for you. You deserve to have this conversation, and you deserve a healthcare provider who will take it seriously. Let me also mention a few other common medications that are known to deplete B12 or interfere with its absorption. Proton pump inhibitors, drugs like omeprazole and pantoprazole, which are used for acid reflux and heartburn, reduce stomach acid, which is needed to separate B12 from the food proteins it's bound to. Long term use of these medications is directly associated with B12 deficiency. H2 blockers like famotidine have a similar effect, though generally milder. Certain antibiotics taken over a long period can also disrupt the gut environment in ways that reduce B12 availability. And as I mentioned, the natural decline in intrinsic factor with age compounds all of these effects. So, what does this mean in practical terms? It means that many older adults are facing what I think of as a perfect storm of B12 depletion, declining intrinsic factor, reduced stomach acid, one or more B12 depleting medications, and a diet that may have shifted away from high B12 foods like red meat and shellfish simply due to cost, digestive issues, or changing appetite. The deficiency builds silently. The nerves suffer quietly. And the person wonders why they feel so much worse than they expected to feel at this age. Now, I want to talk about supplementation, specifically what form of B12 to use, how to take it, and what dose the research suggests is effective for nerve repair. Because not all B12 supplements are created equal, and this distinction matters more than most people realize. When you walk into a pharmacy or a health food store and look at B12 supplements, you will usually see two main forms, cyanocobalamin and methylcobalamin. Cyanocobalamin is the synthetic form. It's cheaper to produce, it's more shelf stable, and it's what you'll find in most generic multivitamins and B complex supplements. It's not harmful. Your body can convert it into the active forms of B12, but it requires an additional conversion step. And in some people, particularly older adults and those with certain genetic variations in an enzyme called MTHFR, that conversion is less efficient. Methylcobalamin, on the other hand, is already in its active neurologically available form. It does not require conversion. It crosses the blood brain barrier more effectively. It has a stronger affinity for nerve tissue. And crucially, the studies that have shown the most impressive results for nerve repair have specifically used methylcobalamin, not cyanocobalamin. When I talk about B12 reversing nerve damage, I am talking about methylcobalamin. In terms of delivery method, and this is important for older adults, given the absorption issues I described earlier, oral supplementation in the form of sublingual tablets or sublingual liquid is significantly more effective than standard tablets or capsules. Sublingual means under the tongue. When you place B12 under your tongue and allow it to dissolve and absorb directly through the mucous membranes in your mouth, you bypass the digestive system almost entirely. You bypass the need for intrinsic factor. You bypass the stomach acid dependency. The B12 goes directly into your bloodstream and from there, directly to your nerves. This is the method I recommend looking into for anyone over 65, and particularly for anyone with known or suspected atrophic gastritis or who is taking acid reducing medications. In clinical studies focused on nerve repair, the doses of methylcobalamin used have typically ranged from 1 milligram to 15 milligrams per day, with higher doses used in cases of existing neuropathy. For general maintenance and prevention, doses on the lower end of that range are often sufficient. But if you are dealing with active nerve symptoms, tingling, numbness, burning, weakness, working with your doctor to explore a therapeutic dose at the higher end of that range may be appropriate. The good news is that B12, even at high doses, is considered extremely safe. It is a water-soluble vitamin, meaning your body excretes what it doesn't use, and toxicity is not a concern at the doses used for nerve repair. I also want to spend a moment talking about what pairs well with methylcobalamin because nerve health is not a single nutrient story. While B12 is the star of today's conversation, it works synergistically with several other nutrients that are worth knowing about. The first is folate, specifically methylfolate, which is the active form. Folate and B12 work together in a process called one carbon metabolism, which is fundamental to DNA synthesis, cell repair, and myelin production. If you're taking high dose B12, adequate folate is important to maintain balance. Many people are now choosing methylfolate over folic acid for the same reasons I described with methylcobalamin versus cyanocobalamin. It's the active form, it requires no conversion, and it's more directly available to your cells. The second nutrient I want to mention is alpha lipoic acid. This is a powerful antioxidant that has its own track record in neuropathy research. It reduces oxidative stress in nerve tissue, which means it protects nerves from the kind of cellular damage that accumulates over time. Several studies have shown that alpha lipoic acid can reduce neuropathic pain and improve nerve function, particularly in diabetic neuropathy. It's often used alongside B12 in integrative approaches to nerve repair, and the two appear to complement each other well. The third is vitamin D. Many older adults are deficient in vitamin D, and emerging research suggests that vitamin D plays a role in peripheral nerve health and may contribute to the development or worsening of neuropathy when levels are chronically low. Getting your vitamin D level tested and supplementing if needed is a simple step that supports not just nerve health, but bone density, immune function, cardiovascular health, and mood. And finally, magnesium, specifically magnesium glycinate or magnesium malate, which are the forms best absorbed without causing digestive discomfort. Magnesium is involved in hundreds of enzymatic reactions in the body, including those related to nerve signal transmission. Low magnesium is associated with increased nerve excitability, which can worsen the sensations of tingling and burning. It's also involved in muscle function and sleep quality. Supplementing with magnesium, particularly at night, is something many people with neuropathy find quietly but meaningfully helpful. I want to take a moment now and speak to something that I think is worth addressing directly, because I hear this from people often. Some of you may be thinking, if this is so straightforward, if the research is there, if the solution is available without a prescription, why hasn't my doctor told me about this? And I understand why that question carries some frustration. The honest answer is that nutrition education in medical training is limited. Most doctors receive very little formal instruction on the clinical applications of specific vitamins and nutrients. They are trained in diagnosis and pharmacological treatment, and they are often operating under significant time constraints in clinical practice. That doesn't mean your doctor doesn't care about you. It means that there are genuine gaps in the system, and navigating your own health, particularly in your 70s and beyond, sometimes requires you to be your own advocate. It requires you to bring information to your appointments, to ask for the tests you want, to have the conversation even if it feels uncomfortable. You deserve a complete picture of your health. You deserve a conversation about why your nerves are suffering, not just a prescription to manage the symptoms. And you deserve to know that your body, even at this age, has the capacity to heal. Let me also address something for those of you who may be skeptical of supplements in general, or who have had a doctor tell you that supplements are unnecessary if you eat a balanced diet. That advice, while well intentioned, does not account for the absorption issues specific to older adults that I've described today. A balanced diet cannot compensate for lost intrinsic factor. Food based B12 cannot bypass a depleted stomach. For a younger, healthy adult with no absorption issues, dietary B12 may be sufficient. For someone over 70, particularly someone with any of the risk factors I've described, supplementation is not optional. It is necessary. The research on this is clear, and it is consistent across multiple studies conducted across different populations over many years. Now, I want to come back to the 14-day claim because I want to be specific about what that means and what it looks like in real life. When people begin supplementing with therapeutic doses of methylcobalamin, particularly via sublingual delivery, many report the first changes within the first week. Not a complete resolution, but a change. The tingling may shift in character or intensity. There may be moments of warmth or movement in areas that felt numb. There may be a subtle but noticeable improvement in energy. By the end of 2 weeks, in cases where B12 deficiency was the primary driver of the symptoms, meaningful improvements in sensation, balance, and comfort have been documented both in clinical settings and in the real world experiences of people who have simply started supplementing correctly. What happens over the following weeks and months is a continuation of that process. Myelin sheath repair is not instantaneous. It takes time for the full structural restoration to complete. But the direction of change, from damage toward healing, begins almost immediately once the deficiency is corrected and the raw materials for repair are present in sufficient quantity. I want to close today by bringing this back to you, the specific person watching this video right now. If you've been living with nerve discomfort and accepting it as a done deal, I want you to hear me clearly. It may not be a done deal. Your body may be waiting for something it hasn't had access to, something as available, as safe, and as affordable as a sublingual methylcobalamin supplement taken daily. That possibility is worth exploring. It is worth a conversation with your doctor. It is worth getting your B12 level tested, and if your doctor orders the test, ask for both the serum B12 result and a methylmalonic acid test because serum B12 alone can be misleading. Methylmalonic acid is a more sensitive marker of functional B12 deficiency, and it can reveal deficiency even when serum B12 appears within the normal range. Your nerve health is not a lost cause. The research says otherwise. The biology says otherwise. And if I can leave you with one thing today, it's this: 70 is not too late, 80 is not too late. As long as nerve tissue remains, the potential for repair remains. What your nerves need is the right support, and now you know what that support looks like. Please share this video with someone you love who is dealing with tingling, numbness, or unexplained fatigue. This information reaches people who need it through you, and that matters more than you know. And if you haven't already, subscribe to this channel because I am here every week with honest, practical, research backed health information for people who want to age well and live fully. Take care of those nerves, take care of yourself, and I'll see you in the next one.